Hello, my name is Money-Kyrle and I'm a consultant cardiologist based in Buckinghamshire and Oxfordshire. The aim of this video is to give a short overview of what you might expect during a consultation with a cardiologist about your heart. It is designed for people who think they may have a problem with their heart and want to know what to expect during an assessment. If you feel you might have a heart problem, I would always recommend discussing it first with your GP. As a cardiologist, I see patients with many different types of heart condition. These can occur at any age and inevitably cause a considerable amount of anxiety. Many conditions fortunately turn out to be relatively minor, but should there be a more serious issue, then the cardiologist should be able to guide you through the options for treatment. People with heart problems present in many different ways. They may suffer from palpitations, which is the feeling that the heart is beating fast or irregularly. They may have chest pains or breathlessness. Some people suffer blackouts or dizzy spells. Other patients who come to me may have seen their GP who has uncovered a problem, for example, a heart murmur or abnormal ECG, high cholesterol levels or high blood pressure. Alternatively, patients may already have a previous diagnosis of something, such as a heart attack or heart failure, which is when the heart is not pumping hard enough, or an abnormal heart rhythm, such as atrial fibrillation or AF. All of these examples are common ways in which patients end up being referred to me. The initial consultation allows the patient to define the problem and tell a story of how it started, what symptoms have been like, and how the condition has been managed so far. If I were to take the example of chest pain, I would want to know all sorts of things about it, such as when it started, whether it feels sharp or dull in nature, how long it lasts, what sort of things provoke it, such as exercise or breathing deeply, whether it's exacerbated by pressing on the chest wall or lying down, or whether eating food affects it. All of these questions will give me an idea as to whether there is a high probability that this is a serious heart condition, or whether it's more likely to be due to something quite different, such as acid reflux from the stomach or a lung or musculoskeletal problem. I will generally ask about other risk factors for having heart problems, such as diabetes, high blood pressure, cholesterol, smoking, family history, that sort of thing. I will want to know about any other medical conditions and about tablets the patient has been prescribed. After discussion, I would listen to the heart for murmurs with a stethoscope and look for any signs of heart disease. The blood pressure is checked, although I don't worry too much about the initial reading because many patients are a little nervous, and this is likely to push the blood pressure up. Further blood pressure readings over time will give a more accurate picture. Most patients will need an electrocardiogram or ECG. This is an extremely useful screening test for heart problems and involves placing electrical leads on the limbs and across the chest, which detects the electrical activity of the heart. It's completely painless but provides information about the rhythm and state of health of the heart and whether there has been any previous damage to it. For example, here is a normal ECG beside one from a patient having a heart attack. The difference in the shape of the complexes is quite obvious in this rather dramatic example. Many patients will be offered an echocardiogram or echo test. This is an ultrasound of the heart. The technology is the same as that used to monitor babies during pregnancy, but it's configured to display the heart and to measure the flow of blood through the heart. This is perfect for assessing the anatomy of the heart and the function of the heart valves. In this example, we compare the performance of a healthy heart with that of a patient with severe heart failure. We can see the main chamber of the heart, the left ventricle, is dilated and the contraction is reduced compared to the normal heart. In this second example, the mitral valve, which lets blood into the main chamber of the heart, is leaky, resulting in some of the blood going backwards every heartbeat instead of forwards. This is a common cause of heart murmurs. Once the initial consultation has taken place, it is often necessary to arrange further tests to assess the heart. If a patient has chest pain, I might recommend an exercise tolerance test, which is used for assessing angina-type pain. In this test, patients walk on a treadmill, which starts slowly but speeds up every 3 minutes, with a gradual increase in the slope. During this exercise, the ECG is continuously monitored for changes that are characteristic of coronary artery disease. This is the condition in which the coronary arteries become furred up with fatty tissue. A patient with palpitations or blackouts is likely to need a 3-day ECG monitor or R test to look for abnormal heart rhythms or pauses in the heart rhythm which might need treatment with a pacemaker. If blood pressure is the issue, then monitoring with a 24-hour blood pressure monitor may help. There are many possible tests that can be arranged to assess the heart, many of which prove to be reassuringly normal and suggest that the patient is in a low-risk category. Patients who are found to be in a higher risk category may need further investigation and are often started on medications to treat the problem and reduce the risk. This concludes a short summary of what is likely to occur during or as a result of an initial consultation with a cardiologist. If you would like more information about this or any other issue relating to the heart, then please feel free to contact me through the web link or contact details beside this video. Alternatively, you can contact your GP for further information.